I think those are very, very good points, Mr. Kwame. I did mention this earlier, but I actually started my career as a radiation oncologist in training at a national hospital, which was at that time the premier, the number one cancer treatment center in Nigeria. We had all the top-notch equipment, and yes, most of our patients were coming presenting very, very late. And even though we did what we could for them, but that was a major problem. So yes, I totally agree with you that there should be more enlightenment and more awareness about it in a way that they can intelligently act upon it. Forgot to mention during the program that as a way of prevention, if it's something like breast cancer, for instance, women should maintain the habit of doing their daily or monthly checks, check their breasts, get familiar with their breasts consistency and contour and shape and size and all that, so that they would be quick to notice anything different. But the general principles for detecting if you have cancer is basically, again, you need to have that high degree of suspicion. Ideally, in a developing country or developed countries, excuse me, ideally you should be having that annual physical to catch these things in time. But I'm surprised to hear Dr. O say that even Black people here don't like doing colonoscopies, even if it's available, right?
Yeah.
That's crazy.
Yeah.
That's crazy. Well, most Black people, most of us back home don't have access to it. So it's. I mean, I guess if we did, we probably would still be hesitant to take it. Kind of like we're hesitant to go to see the psychiatrist for any problem, lest we be branded psycho. So it's an issue. I see it's an issue that is built or etched in our genes because it expresses itself worldwide wherever we are. Back to your own personal responsibility. If you begin to notice changes, whether in your urine or whether in a swelling or a swelling that was there before and is now taking on a different characteristic, maybe it was a soft swelling on your skin and then it becomes harder, or it changes color, or you begin to lose weight for whatever reason, and you know it's not tuberculosis or any of the other infectious diseases. These are all things. It all comes back down to awareness and education, quite frankly. Awareness and education. But over here in the US, it's like people are primed to look out for cancer, just primed. I think amongst us, we are primed to fear that, it can't be. That's not my portion. And so even if the thought comes, it's like, no, it can't be. So you don't really want to go and check to see whether or not it's a case. So I think that's very important. A very good point about oral health. I do mention it in a lot of my presentations. Oral health is super important because the bacteria that can cause damage, the most damage, some people say are in the teeth and the gums to the rest of the body. They can cause increased inflammation in the body. They can cause damage to the blood vessels. They are the worst and probably most dangerous bacteria lie in the gums and in dirty, bad dental hygienic places. And so they can go directly into the bloodstream and straight to the heart and then begin to wreak the havoc in the blood vessels and in the brain and so on and so forth, and eventually can cause cancer. Don't ask me how, but it happens. Same thing with gut health. I like that you mentioned it. I'm very, very big on gut health because a large population of my patients are children with autism. And with autism, if you can't get gut health right, yeah, you can forget it. If you can't clean up their gut and get their gut as healthy as possible, then you can forget it. You're not going to make any progress. The same thing with cancer and pretty much any other disease. I mentioned it during my talk that you've got to take care of the gut because 70 to 80% of the immune system is in the gut. So if your gut is unhealthy, if you're constantly putting toxins in your gut, and by the way, toxins in the bloodstream can eventually get excreted into the gut as well. So the gut tends to, if you're not aware of this, I just keep on putting all kinds of bad stuff in your body, junk food, sugary stuff, and you're constipated, or you're not going to the bathroom like you should, there's a lot of junk and toxins that tend to accumulate in your gut, shutting down your immune system, and can cause eventually set you up for things like cancer and other kinds of diseases. So gut health is super important.